The question is that this House has considered access and waiting time standards for early intervention in psychosis. Dr. Cameron.
Many thanks. It's an absolute pleasure to serve under your chairmanship today, Sir Roger, and I'd like to once again thank the Right Honourable Member for North Norfolk for bringing this extremely important debate to Westminster Hall. I have to declare an interest at the start, having worked as a clinical psychologist for 20 years in the NHS, and also as a continuing member of the British Psychological Society, our professional body. I'd like to start by giving a little bit of context, if I may. I'm heartened, I think, by some of the progress and the initiatives that have been made by governments, both in the UK and in Scotland, over the years on mental health, because when I started out, it was quite commonplace that patients would wait for up to and over a year for treatment, and there didn't appear to be an urgency in terms of dealing with the waiting lists, dealing with the waiting times, and I think that has very much improved. We have waiting list standards, heat targets, which very much focuses service providers, policy makers. It also focuses resources. So things are improving, but quite clearly we still have very much work to do in this area. And I think, again, it's something that I would concur with, that we do need to work in a conjoined way right across the UK and to share best practice models in doing so. So it clearly wasn't good enough, the service that we had when I started out in practice. Patients were waiting far too long by the time they came to treatment. They'd often been admitted to hospital in an acute situation, perhaps suicidal. They'd had multiple episodes of psychosis. We really weren't providing the best standard of possible care. In terms of psychosis, it's a very distressing illness for people. It's an illness which tends to be long-term, although people can recover at an early stage if we pick up their symptoms and provide the appropriate care timelessly. So in terms of psychosis, people are experiencing symptoms of paranoia, often experiencing delusional belief systems, which take them out with reality. They may be experiencing hallucinations, visual and auditory. It's distressing for the person, but it also very much impacts, I believe, on their family and those around them. So it's something that we must take very seriously, and although it only affects quite a small proportion of the population, has huge ramifications in terms of family relationships, and that's also something that I'd like to focus on today. Yes, I will indeed.
Thank you very much, Roger. I'm very grateful to Honourable Lady giving way, and what she is building on a very impressive speech by the Honourable Member of North Norfolk. Would the Honourable Lady accept that whilst it is right that we see how quickly people are going to be treated once diagnosis has been secured, securing diagnosis is the biggest barrier to early intervention treatment. And from personal experience, my wife struggled for 2 years to get a diagnosis. Once she got the diagnosis, treatment was in place, but it was far too long to wait. And until we crack that nut, and don't dismiss symptoms, don't dismiss the struggles that people have, but deal with them practically and sympathetically and professionally, then early intervention is only a myth that we can discuss. We need the diagnosis first.
Yes, I'd like to very much thank the Honourable Gentleman for that intervention and for his own personal experience and family experience. I think that is totally true, and it is about shortening that gap between presentation and emergence of symptoms and diagnosis, and that's also true in other types of mental health problem and developmental disorders such as autistic spectrum disorder is one that stands out to me, particularly because parents often struggle for years to ascertain a diagnosis, and therefore they don't receive appropriate intervention early enough. They struggle with understanding their child, and the family relationships can deteriorate as a result. So yes, I very much concur with the point made. That's why it's such an important development, positive development, that there is the standard in England, and you know, that it was set by the Mental Health Task Force, and it is to achieve parity of esteem. But again, I would agree that we can't just have that in words. We must have the action to follow. It also establishes that there is this initiative and standard, that it's a national priority, and I think that that's important because it hasn't been in the past. Mental health services have been seen as an adjunct often, and that's not good enough, because we know that 1 in 4 people can experience depression, for instance, in their lives, and many more experience other types of mental health problems, for instance anxiety. So although there's only a small proportion of the population will experience psychosis, mental health is problems and difficulties are widespread, and most of us at some point will experience or have experience of someone who in our lives has had mental health difficulties. So it's so important that we have this in place, that care is within 2 weeks from referral. But it's also really important that the data is recorded, because it has to be standardised, and I think that's the other issue. Often some trusts will be able to implement things more quickly than others, but what we need to do is ensure that there isn't a postcode lottery across services, and that people can access good mental health provision wherever they may be in the country. So I would like to welcome that. I think just also to speak a bit about the services required. I mean, in terms of psychosis, they're multi-professional services. So we're speaking about a team, a specialist team that's required, and a team where it's often you know, labour intensive. It's costly in terms of provision of the team, but I think over the long term, the cost effectiveness is what we should be focusing upon, because, as I think has already been made by the Right Honourable member who brought the debate, the point is that if we don't intervene early, the cost to society, the cost to the health service, the cost to people's lives far outweighs any cost in terms of NHS provision that we must make. Standards focus policymakers on resources and ultimately improve care. The Scottish Government are currently undertaking their consultation on the mental health strategy, and early intervention and prevention will be key pillars in that regard. We now have a mental health minister, Maureen Watt, who will be focusing in terms of delivery of the strategy, and the strategy will be informed by carers, by service users, by professionals, and by research best practice. Just to speak about one of the projects that I'm aware of in Glasgow, run by colleague Susie Clark, the STEAM project, which covers Argyll and Clyde, and is an early intervention service for psychosis. There is no waiting list, I understand. Patients are usually seen within 5 days from referral, which is, you know, a huge change from the days when I started out, and I've explained. If patients are admitted to hospital, then they're assessed in this service within 24 hours. So that's something that people can feel supported straight away. And it's very much a holistic service, looking at psychiatry, a medical model, but also looking at psychological interventions and family supports. In terms of NICE guidelines, CBT for psychosis is really important. That helps people who are suffering from the positive symptoms of psychosis to begin to reappraise those symptoms, to once again make that connection with reality and begin to be rehabilitated back into day-to-day life. And behavioural family therapy is also extremely important, because, as I've mentioned, psychosis doesn't just affect the person who suffers, it affects their whole family and social circle. People can suddenly find themselves in a caring role, and research indicates that if you have up to 10 hours and above a week as a carer, then that's also a challenge to your own well-being. So once again, we can see the ramifications in terms of avoiding putting the best practice in place and not giving the early intervention the priority that it deserves. Depression is common in carers. What they describe is a need for information, for practical help, for emotional support, often from other people who are in a similar situation. But the outcome, crucially, for the individual who suffers psychosis also depends partially on the relationship between themselves and their carer and family. So that's why services and treatment have to look at the individual in a very holistic manner and make sure that the interventions that are available also encompass family. So the STEAM project provides CBT for psychosis, behavioural family therapy, and also helps the individual to look at early warning signs. What are their symptoms when they start to become unwell? How can they identify them at an early stage so that they can contact the appropriate providers if they have a subsequent episode? Outcomes from the first episode study by Professor Gumley at Glasgow University show massively significant and favourable outcomes following early intervention and service involvement. And I understand and must mention that Tony Morrison is also leading on this in Manchester. So we can see that there are areas of expertise developing right across the UK, which is heartening. So we need to focus on early intervention. It's key. It leads to better prognosis. It has better outcomes, and it also reduces the risk of further relapse. It helps the person reintegrate into society, and it assists their carers and family. It's also cost effective. So just in concluding, I'd like to welcome the Minister to her place and urge at the same time that the direction that has been given is the one that's recommended. It is best practice. We need it in terms of service delivery. We need it in terms of patient care. We need it in terms of clinical and cost effectiveness, because we must ensure that there is parity of esteem for mental health.
Yeah.
Thank you.